PG pattern 2022 MCQs. Okay, let's begin. Incontinentia pigmenti associated with all except option A X-linked recessive, B is neurocutaneous syndrome, C is lesion subside in adulthood or dental abnormalities. So guys, this MCQ wants to ask which one is incorrect. So answer is X-linked recessive. Why? Because incontinentia pigmenti is X-linked dominant, okay, not X-linked recessive. Now bullous impetigo caused by Streptococcus, E. coli, Staphylococcus aureus or Klebsiella. So this is mainly caused by Staph aureus. Okay, this is, they are very high yield MCQ for exam point of views. Now bullous impetigo treatment by all except fusidic acid, isotretinoin ointment, mupirocin, retapamulin. So they are asking except. So except is isotretinoin ointment is not going to use in treatment of bullous impetigo. Now man feels or believed to have special powers. Okay, man feel he has a special powers. This is known as echolalia, ecopraxia, nihilism, magical thinking. So guys, echolalia means repetition of same words. For example, you say hello, he also say hello. You say what's your name, he also repeat what's your name. So this is echolalia. Ecopraxia, repetition of same actions, movements. This is known as ecopraxia. Nihilism means depression, nothing is there, no sadness everywhere. So magical thinking, one statement is remaining. So this is magical thinking. Special power means some magical thinking. Patient has a delusion belief that body is infested by parasites. Declarambol syndrome, Ickbaum syndrome, Atalo syndrome. So what is Declarambol syndrome? When a low socio-economic status girl or any girl, she feels that a celebrity or a great personality fallen in love with her, but in reality not so. So this is known as Declarambol syndrome. For example, a simple normal girl feel that Salman Khan fallen in love with her, and in reality Salman Khan don't know about her. So this is an example of. And Othello syndrome means a husband always thinking about her wife, she has a relationship with another man. Okay, uh, always he feel jealous, and always in spite of giving proof he can't able to believe. This is Othello syndrome. And Egg-bomb syndrome, this one is a delusion belief that body is infested by parasites. Okay, so answer here is Egg-bomb syndrome. This one, second option is right, B. Now they are very high yield for exam point of view MCQs. Person response is related to the question in distant way and he never reaches the goal. If you are asking what's your name, person reply uh, Taj Mahal located in Agra, and from Jaipur to Agra distance is 500 kilometer, and Jaipur to Delhi. You are asking name, but he never reaches a goal. So what does it mean? Firstly, discuss circumstantiality means if you ask the what is your name, he say I'm studying in 10th class and my teacher name is this and my father name is this, and finally he comes his name, he say my name is this. So this is circumstantiality, but here patient not reaches the goal, so this one is known as tangentiality. Okay, now reimplantation of amputate limb, which one? So how to summarize how to reimplant amputate limb. Remember B mnemonic. B fan was. B for bone. First implant is bone. Second is extensor tendon, then flexor tendon, then arteries, then nerves. So here nerve, then arteries, and then vein, then skin. So last is skin. In this MCQ, they want to ask last implant is of amputated limb is skin. Remember that mnemonic. Now, most sensitive investigation for early bone infection is CT scan, MRI, bone scan, or sonography. So answer is MRI followed by bone scan. If MRI not in option, then go choose bone scan. Now, bad prognostic indicator of Pott's paraplasia are all except dry lesion, vertebral disease healed, mycetomalacia cord status on MRI, or early onset. So guys, dry lesion is a bad prognostic, wet lesion is a good prognostic. Vertebral disease early stage is without healing is good prognosis, but healed is bad prognosis. No code changes is good prognosis. Mycetomalacia cord status on MRI is bad prognosis. Late onset is a bad prognosis, but early onset is a good prognosis. So answer is early onset. They are asking except. Now, severe systemic disease that is constant threat of life, ASA class. If class 1 no disease, okay, so this option is cancel. Second option, patient has some diseases but activity is perfectly normal, so this option is also eliminated. They are asking severe systemic disease that is constant threat of life. And third one is patient is suffering from disease but there is a risk, okay, but not life threat. Fourth one, there is a life threat and severe systemic disease. Third one is impaired activity. And fifth is morbidity. If you do surgery, lot of chance patient die. If you are not going to perform surgery, lot of chance to patient die. So this is fifth, but here answer is fourth one. Okay, fourth one. Why? Because this severe systemic disease that is constant threat of life is fourth. Now, 6-month child admission for open pyeloplasty, breast milk allowed up to. So in 6-month child, up to 2 hours we give water, not breast milk. Up to 4 hours we give breast milk. Up to 6 hours some food, etc. Okay. Now, difficult, inadequate mouth opening, inadequate neck movement. Method of intubation in this case, tracheostomy, LMA is laryngeal mass airway, fibro-optic intubation, or none. So guys, in difficult intubation, neck movement restricted and difficult mouth opening, so intubation by the help of fibro-optic intubation. Okay. Now, in Wernicke's encephalopathy, area of hypothalamus is involved in this condition. Dorsomedial nucleus, mammillary bodies, anterior nucleus, ventro-posterior-lateral nucleus. So guys, answer here is mammillary bodies. If in exam they give thalamus involved in Wernicke's encephalopathy, so that one is dorsomedial nucleus. Okay. This frontal sinus, about PNS I already deliver complete lecture in my 150 important topics where I already explain everything. Let's discuss again. Best view for frontal sinus. For frontal sinus, best view, lateral view is for all type of sinuses. You see all type of sinuses, but they are asking particular frontal sinus, so this is not. Water view is best, I already explained lecture. Reverse the W, then maxillary sinus, so this is not. Peri For water view is closed mouth visualization of maxillary sinus, whereas Paris view is a open mouth of water view. We see sphenoid sinus here. So which one is left? Caldwell's view is a best view for frontal sinus. Okay. Now, man injured his leg with sharp wood. Which investigation ordered initially if wood part retained? So guys, in this case we advise sonography, USG. If this is a sharp metallic part, then X-ray. If this is a glass, then X-ray. If it's plastic and wood, then USG is best. Now, avascular necrosis of femur, investigation of choice. CT, MRI, USG, bone scan. In avascular necrosis of femur, MRI is the investigation of choice. Now, what is the location of tricuspid area? Let's discuss all options together. Fifth interspace, left interspace medial, that is for mitral valve. And third left interspace parasternal line is for Erb's point. And second left interspace close to the sternum, that is for pulmonary arteries. And first left right intercostal space with sternum, that is for aorta. So fourth one is left, fourth one is for tricuspid area during auscultation. In systemic lupus erythematosus, type of nephritis is focal, rapidly progressive nephritis, membranous nephritis, diffuse nephritis. So best answer here is sorry when I open this. So answer is diffuse nephritis in SLE, whereas chronic hypokalemia lead to metabolic alkalosis, metabolic acidosis, respiratory alkalosis, and respiratory acidosis. For chronic hypokalemia leads to metabolic alkalosis. If chronic hyperkalemia, it leads to metabolic acidosis. Okay. Now, pulmonary embolism risk factor for all except malignancy, pregnancy, estrogen therapy, progesterone therapy. Guys, malignancy is a risk factor for pulmonary embolism. Pregnancy also. Estrogen therapy definitely, but progesterone therapy is not associated with a pulmonary embolism risk factor. Now, site of lesion in Weber syndrome, left ipsilateral cranial nerve 3 palsy, right contralateral hemiplegia. So guys, left ipsilateral cranial nerve palsy. So answer here is left midbrain. Okay, involvement of lesion in left midbrain, right contralateral hemiplegia. So midbrain is involved. Now, very high Prader-Willi syndrome, seen all except hypophagia, underweight, mental retardation, hypogonadotrophic hypogonadism. So answer is, if there is a hyperphagia, underweight is not possible. In Prader-Willi syndrome, there is obesity. So answer is underweight. They are asking except. Okay. Most common cause of non-alcoholic fatty liver disease: Ray's syndrome, pregnancy, drugs, or syndrome X. What does it mean by syndrome X? This is metabolic syndrome. So most common cause of non-alcoholic fatty liver disease is metabolic syndrome or syndrome X. Guys, this is important. Now, best screening test for ulcerative colitis: ASCA, fecal calprotectin, CRP, P-ANSA. So guys, for ulcerative colitis, best answer is P-ANSA. For Crohn's disease, answer is ASCA. Okay. So guys, thank you for watching this video. Thank you. Good day. Goodbye. If you like this video, put like on it. If somebody is new on my channel, please subscribe it for more such videos, for more such updates. Thank you. Good day. Goodbye.